Got to do that myself. Good afternoon, Scurry County. I'm Dan Hicks, County Judge, and I have Tammy Quick with me. She is the director over at the Senior Center. So thank you for coming,
Oh,
Tammy.
you're welcome. Thank you for having me.
Absolutely. All right. First, I'm going to go over the count. We're going to do Texas, Scurry County, and then I've added a few others. So bear with me just a moment. In Texas, there's been 146,467 tests. There's 1,409 in the state in the hospitals in Texas. That was up from a little over 1,100 yesterday. Cases reported 14,624 in Texas. 318 fatalities. 2,580 patients have recovered, and there's 181 of 254 counties that have reported. Scurry County, our testing has gone up to 52. There's 6 pending, 44 negatives, and there's still only the 2 cases. I'm going to give you Lubbock, Taylor County, Midland County, Ector County, Tom Green, Nolan, Fisher, and Mitchell real quick. Just added a few more so that we can kind of know what's going on around us. Lubbock has tested 3,376. They have 377 positives. They've had 72 recover, 21 deaths, and 86 tests are pending. Taylor County has tested 1,028. They have 68 positives. They have 804 negatives, 156 pending, and 1 deceased. In Midland, 814 tested, 32 positives, 2 deceased, 729 negatives, and 50 are pending. Ector County has 631 tested, 46 positives, 2 deceased, 516 negatives, 69 pending. Tom Green County had 986 tested, 39 positives, 1 deceased, 892 negative, 55 are pending. Nolan, Fisher, and Mitchell counties all go through the Nolan County hospital, the hospital in Nolan County. There have been 84 tested in those 3 counties. Nolan County had 52 negatives, 19 in Mitchell County, 8 in Fisher County. Those are all the negatives. There's only been 1 positive in those 3 counties, and that's in Mitchell County. And there's a total of 4 pending, 3 in Nolan County and 1 in Fisher County. I should have closed this door before we got started. I'm going to go ahead and close that, but we're going to talk about what y'all are doing over at the Senior Center with all of this, all these changes that we've had to do. You've had to do some different things and reinvent how y'all are doing the meals and all.
Right.
You're still doing the Meals on Wheels.
We're still doing Meals on Wheels. The home delivered meal program, we're still serving about 105 to 108 a day. It takes 12 volunteers every day to get those 4 routes done. Still having volunteers come in. We've had some that weren't comfortable coming in. They haven't. Staff has stepped up and been going out. So between volunteers and staff, we're getting that all done.
Good.
So,
okay.
Yep.
And so you've got people coming in to come and drive through to get meals.
Yes.
You told me yesterday you have more coming through the back door than you had coming in the front door.
Yeah. We're serving about 60 or so a day. Yeah, coming through.
Okay.
If you want a meal and you want to come to the center and get you a meal at noon, we're serving from noon to 12:30. And you could just pull up to the back where the bus is parked and kind of by the Travis gym. Pull up back there. Staff is watching, and we'll come out and find out how many meals you need and get you a meal. Yesterday on Facebook, somebody asked if you were under 60, if you could still come get a meal.
Sure.
Absolutely. It's the same procedure, same rules as when we're serving a congregate meal. We just ask that you pay $5 if you want to come get your meal and you're under 60.
Okay.
So, which is still a good deal.
Yes, that is a good deal.
Yeah, it is a good
Absolutely.
deal for your lunch. So, we'll have a little bit of if you come in like that. So.
Okay. And I've had the meals there, and they're great.
Sherry keeps a tight ship back there, and she's been doing it a long time, and she's good. Yeah. She cooks a good meal.
That's good. I'm glad to hear that. It's got to be hard with the major changes where nobody can come in and do what their activities and do the embroidering and whatever else they do in there.
The quilting. I've only had one wife call and say, "Can they come play dominoes because he's driving me nuts?" So that's not bad. That's not bad. No, that's not bad.
Yeah. We normally have May Day come up pretty quick.
Yeah, we would be in the middle of May Day right now getting it all ready. Yeah. So that's kind of sad.
Yeah, it is. But it's not going away for this year, right?
No, we're postponed. I haven't made any concrete plans because
Mhm.
we don't know where this ends.
Right.
And so when we have kind of an ending date of when we kind of get some semblance of normal back
Sure.
in a regular schedule, we'll get with the Coliseum, see if there's something we can do later.
Mhm.
We may try to have a little craft show kind of thing at the center, but the ladies have worked hard on the quilts.
Right.
We've had some new crafts. We were so excited. Our craft booth was going to be outstanding this year.
Yeah.
And we're just going to have to reinvent it and postpone, but we're not going to cancel. We're going to do something at some point. I just don't know what.
Okay. All right. Well, that sounds great.
Yeah.
We'll keep everybody updated
Yeah,
on when we're going to do
absolutely.
that, when y'all are going to do that.
Yep.
So as far as donations, I know you take
Mhm.
cash donations.
Mhm.
For like May Day, do you take donations of projects that people want to
Mhm.
donate so that the money could go to the
Mhm.
senior center?
Yeah, absolutely. Sometimes people will donate a quilt top and then
Mhm.
the ladies will quilt it. We've had quilts donated that,
Mhm.
and sometimes we'll put them in the silent auction booth. Sometimes we put them in the craft booth. Sometimes they go in the quilt auction. So
Okay.
if somebody wants to make something at home, a craft thing, then you can bring that in. We'll put it in the craft booth.
Okay.
The sweet tooth booth, we're always taking donations for that.
Sure.
Yeah.
I've got
Silent
one of those.
auction.
Yeah.
Silent auction. The businesses have always been very, very supportive of this May Day when we do the silent auction booth. So
Okay.
yeah, we'll be hitting everybody up, but we
Okay.
just don't know when.
Right. That's good. I have one of those, a sweet tooth.
Hmm.
I like sweets, so I will be there definitely
Yeah.
for that whenever it comes up. So I'm also thinking about the guys that make stuff. They might make
Hmm.
different types of
Hmm.
furniture, or they might turn
Hmm.
stuff on a lathe and things
Yeah.
like that. They can donate
Yeah.
those
Oh,
things as well.
absolutely. Yeah. Some of that stuff we'd either put it in the craft booth if it's
Mhm.
smaller, or some of those things could go in the silent auction.
Sure.
And
Okay.
then that would be a good place for some of the bigger items. And
Artists as well.
absolutely.
I'm assuming.
Oh yeah. Yeah. We'll take
Okay.
anything.
Okay.
Yeah, we will.
Okay. Well,
We
is there
will.
anything else you want us to know about the senior center
Um,
right now?
no, just that we're still there. We're going to be ready to go back. We're going to try to get an exercise program together and
Good.
have just get back to doing what we do and keeping everybody well and healthy and
Yeah.
happy. And, I hate that they're missing that social interaction right now,
Right.
but it's what it has to be. So
Absolutely.
just doing the best we can.
Okay. All right. Well, thank you, Tammy.
Okay,
I'm going to go
thank
over
you.
a few things real quick, and then we'll let us get out of here. Okay. So, Cogdal want to make an announcement on some that they've posted on their website. In addition to increase in testing availability, Cogdal Memorial Hospital is now performing COVID-19 testing on patients who are admitted to the hospital and all obstetric patients. So I guess that's if you're pregnant. That's a big word for me. We're testing 2 to 3 days prior to a scheduled cesarean section or scheduled induction. So if you're going to have a C-section, or you've got your due on a certain day, they're going to test you 2 or 3 days before that. Because of this change, you'll see an increase in individuals tested for COVID-19. As we talked about that the other day, how we're going to see an increase in the testing. Tomorrow, we're going to have Christy Hanley, the chief quality officer, and Bill Dickinson, the lab director for the hospital. They're going to come and talk with you tomorrow about the lab testing that's going on and how it's evolved kind of to this point so far. So be ready at 4 o'clock tomorrow. So there's also been an idea of a community day of prayer. I like that idea. And basically what it would be we would all go out to our drives or outside somewhere, and we'd just pray for our local community, our state, our country, and for the world during this pandemic. Um, we don't have a lot of details on this. This isn't my idea. This is an idea that was posted out there somewhere. I think it's a great idea. I need to get with a few people and see if we can kind of get this worked out on when we're going to do it. And I'll give you some more details on as we go forward. I really want to um, make you understand how important it is that we stay the course that we are. DSHS today has said that we are bending the curve. What we're doing is working. We're not there yet, but we're getting there. Our curve is not as steep as some of the other states. So what we're doing is working. I know it's frustrating. I know it's hard. And I know you're getting tired of all these rules. You're tired of wearing the mask, tired of wearing gloves, tired of staying away from people more than 6 feet. not shaking hands and hugging. But we've got to stay the course right now. We just need to maintain what we're doing, and we will get there. Um, it's an effort that all of us need to do. What we're doing here in Scurry County and across the state is working. We just need to maintain for a little bit longer. We're going to be looking here in the future, near future, local, state, and federal levels on ways to get our economies going. It's going to be a slow rollout process. I feel like I know it is going to be in here in Scurry County. I can't guarantee what the state and the feds are going to do, but I feel like it's going to be a slow rollout process. Just hang in there, keep doing your social distancing, wear your mask in public, wear your gloves, wash your hands, don't touch your face. You'll see me in public. I'll be wearing a mask. If I'm at the stores, I'll probably be wearing gloves as well. I'm the example. I need to set the example. I'm not going to tell you to do something, and I'm not going to do it myself. So more than anything else, keep yourself, your family, and your coworkers safe. With that, I'm going to let you go. Y'all have a great day. Thank you.